Thousands of refugees in South Sudan are living in crowded camps to escape the sporadic fighting along the border with Sudan. Amid the skirmishes, health workers trying to provide basic services say they are worried about the dire healthcare situation in the camps. Karam Malfa is suffering from diarrhea that has left her very weak. A refugee at the Yusuf Batil camp in South Sudan, she is being taken to the nearby health clinic for treatment. But as she traveled to the facility, her condition deteriorated.
She was much better when we left to come here, but she got worse on arrival.
Over 35,000 people now live in Yusuf Batil camp. Camps like this one have been set up by agencies to host people fleeing conflict on the Sudanese side of the border. Health professionals are diligently working to provide basic health care services to the displaced population. The United Nations says over 170,000 people have fled to South Sudan, and in recent months, agencies have ramped up operations to respond to the needs of the displaced and refugee populations. At the clinic, Malfa is quickly put on a drip as part of her treatment.
This is not cholera, but it's just a common diarrhea that we can have around the environment because of the poor sanitation.
The United Nations High Commissioner for Refugees, UNHCR, has raised concerns over the health of the refugees as their numbers increase. The United States and aid groups have also issued warnings of famine in both Sudan and South Sudan, especially in areas held by rebels. The UN says nearly 1,600 children are severely malnourished at the Yusuf Batil camp. Rain and cold weather have also been a factor in the increase of the number of refugees suffering from respiratory tract infections, diarrhea and malaria. Pilar Bosa is a health and nutrition expert with UNHCR.
We have high rates of mortality above emergency threshold, plus high rates of malnutrition, severe and moderate, meaning one kid is severe malnourished out of 7, and one kid is malnourished, moderate malnourished out of 4.
The refugees are supplied with food and other essential items, while health and hygiene outreach programs have been launched to promote basic hygiene. But agencies say they have had some difficulty in reaching some of the camps because many parts of South Sudan are not accessible over the dirt roads during the rainy season. UNHCR's chief medical officer talks about the accessibility problems.
These camps are in extremely, as you know, very, very remote locations. There were no pre-existing services, both for the local populations who also have living in very, very difficult conditions, and for the refugees that came. The roads are almost non-existent, and so nearly everything has to come in by air.
South Sudan voted overwhelmingly for independence from Sudan in a 2011 referendum promised under a 2005 peace deal that ended a long civil war. And the two nations are still negotiating issues, including border security and disputed territories. And UNHCR has been working on the ground to tackle this issue.